Welcome to Duke Spine Institute, live surgery, September 9th, 2025. Our patient hails from Missouri. Is it Missouri? Or Michigan?
Missouri.
All right, Missouri.
The board does not lie.
All right, Missouri. And he has horrible back pain that he's had for years. Shot. And he wants to get rid of it like everybody else. So, shot, he found Duke Spine Institute and discovered, shot, that we were doing these treatments.
So he watched a lot of videos.
He watched a lot of videos, realized this is what he wanted for himself. He wants to get out of pain, and he wants to do it the Duke Spine way. So, shot, we did a nice virtual consultation, shot, and after that he decided, I'm coming here to get it done. AP? I already did. Just knife. So here we are. We're going to fix his back today. Shot. Lateral. We're fixing two discs, L4-5 and L5-S1. Then we're going to fix his facet joints. Shot. Are we going to be able to do a shot, a discogram, or no? We don't have to. It's not the end of the world if we don't.
How you doing, my friend? You all right in there?
Shot.
You all right? We're going to ask you some
AP.
questions, all right?
Actually, we're good.
Good.
Yep, discogram. We're in on both discs. You think he's ready? I think I was too fast for Dr. Burndes, but that's fine. Shot. There we go. There's the tear at 4-5. Shot. There's the tear at 5-1. Shot. Big tear at 5-1. Big tear. Now, he also has a herniated disc at L3-4, but he doesn't have pain there. I asked him. On examination, no pain at L3-4. So his only pain is at L4-5, L5-S1. That's why we don't treat herniated discs because people have a herniated disc. We treat herniated discs that are painful. Or we call it symptomatic because sometimes there's more than just pain. Not all symptoms are pain. Some people have other symptoms. Shot. For example, numbness in the legs, tingling in the legs, weakness in the legs. Those are also symptoms, pain down the leg. So a disc injury in your lower back can cause back pain or leg symptoms. The leg symptoms are weakness, numbness, or tingling, or pain. Four things: weakness, numbness, tingling, pain in the leg, down the leg. Not all leg pain, weakness, numbness, tingling comes from a pinched nerve in your back, or a herniated disc for that matter. Some of it comes from other causes. Shot. Shot. All right, looking good. Very nice, very nice. How long has he had back pain for? 10 years?
10 years.
So he's from Missouri. 10 years of back pain. Today we've had patients from Missouri, Utah, Georgia, Florida, Canada. We represent 5 different locations or locales. Any questions?
At this moment, no current questions.
Then let's share with the audience what are the 30 common causes of lower back pain. Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Welcome back. So, of the 30 different causes of back pain, come on in. The disc is the most common. 85% of back pain, chronic back pain, the primary reason, the number one reason is a disc injury causing disc pain. Disc pain from a disc injury, specifically a tear in the back of the disc causing inflammation. That's what this patient had as his source of back pain. We've just completed the Duke laser disc repair at L5-S1. Next, we're going to move into the L4-5. All right. Any questions?
No current questions, so we do have a comment coming from Faisal on Facebook
Oh, Faisal. Num num.
saying, "Hi, doctor. Hope you're well. Thank you for giving me advice about the 8th left rib."
You're welcome. That's what I'm here for, my friend, to help people. At least help people with what I can help them with, which is spine stuff. I'm not much use for anything else, but at least the people that are here are interested in learning about spine problems, and that's what matters. Take it. All right, any other questions or comments?
At this
If
moment,
not, well then let's share with the audience how these disc injuries can be so painful.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our animation that trauma causes a tear in the wall of the disc. Once that wall is ripped open, then the fragments of herniation will push out. We call them nuclear fragments, fragments of nucleus pulposus. Once they start pushing into the tear, they officially become herniations. They are not herniations until they leave the nuclear area and enter the tear. Once they enter your tear, they are officially called herniations. So we are right now inside the tear at L4-5, and you can see the blue stuff is herniation. We just finished L5-S1, and 5-1 did not have much disc left. As a matter of fact, when we were putting the dilator in, we could see something called vacuum space phenomena, which on the X-ray is a very light area inside the disc. It looks like an ovoid shape in the center of the disc. It's actually an area where there's negative air pressure. It's sort of if you put a needle in there, it sucks air through the needle from the operating room into the disc. So negative air pressure in an area of the disc called the vacuum space phenomenon. Very well-known thing, seen by most spine surgeons. In the case of degenerative disc disease, seen in the middle of the disc. Grabber? This is all scar tissue, mixed in with fragments of herniated nucleus pulposus. And what better tool to remove than the laser? The laser is the only tool that can really remove this stuff. Look how I'm using my grabber over and over again. It just cannot remove these pieces of herniation. Why? Because they're stuck down, and they're stuck down by scar tissue. They're just not an effective use. So I have to mostly use the laser. And if I didn't use a laser, we wouldn't be able to do the surgery. That's how important the laser is. I've got about probably 8 minutes left with the laser here. Then we're going to move on to fixing his facet joints. This patient has not just disc pain from L4-5, L5-S1, but he also has facet joint pain. When I examined him, I noticed that his facet pain was significant. He had pain over the facet joints, which is off center of the disc. The disc is central pain. Facets are lateral pain, pain localized to the side of the spine, usually about 2 finger breadths off of the middle. This patient had that on exam, tenderness and pain off center. We call it paramedian. And I believe he has facet pain. We're going to recommend treating it. We don't do facet blocks on every patient with facet pain. We find them to be superfluous, which means unnecessary. If you know what a problem is, you don't have to do a test to confirm it if you've seen it enough and you're sure based on the patient's symptoms, which we are. All right? Well, look at that tear right there. And you can see some inflammatory tissue right there. That's that reddish pink stuff right there. We're going to remove it with the laser. That's where his pain was coming from for the last 10 years. Now, our last patient from Georgia, he's getting ready to leave. He had pain for 40 years in his back pain for 40 years. This patient's had 10 years of back pain. A lot of our patients come to us with heart histories, history of heart problems, stents, heart disease, and to be honest, they're not really candidates for spine surgery anywhere else but Duke Spine because our treatments are so minimally invasive. We're able to do these treatments even on a patient with heart disease who would be turned away from other doctors. As a matter of fact, Jehovah's Witnesses love us because we don't lose any blood during their surgery. So they don't have to worry about getting a transfusion. Our spine surgeries are done without transfusions. I have never in my career of 29 years had to transfuse a patient after spine surgery. I don't lose that much blood. Now other surgeons do. That's because their technique is not as good as ours, so they lose more blood. It is entirely possible to do spine surgery, even invasive spine surgery, without significant blood loss, as long as you have the right technique. Duke Spine Institute has been performing invasive and minimally invasive surgeries for 22 years without significant blood loss. I've never transfused a patient for spine surgery. Never. We don't lose any blood. I think the most blood I ever lost was 400 milliliters with a big fusion surgery that had lots of scar tissue. 400 ml is 10% of the blood volume. Blood volume is normally 4 liters, 4 to 5 liters, and I lost 400 cc's. So of the 4,000 milliliters, I lost 10%. 10%, a loss of blood volume is not significant at all. There is no clinical symptomatology except for a mildly increased heart rate that occurs with a 10% loss of blood volume. And it's easily made up for with IV fluids.
We have a good anesthesiologist, you shouldn't even have heart rate change.
Yeah. With a good anesthesiologist, you won't even see a heart rate change. All right, we're almost done with this disc. This disc is far more difficult to do than the last one. The L5-S1 was so degenerated there wasn't much work to do. So we got it done pretty quick. But this one has tremendous amount of scar tissue. As you guys can see, all this stuff I'm zapping is scar tissue from inflammation, from the herniation and the tear. It looks like, I don't even know what it looks like soap almost, like kind of hard, like, right, like a bar of soap, except it doesn't melt. If it does break apart, thank God, with the laser. But it is firm. It's kind of like cheese, like not soft cheese, but hard cheese. Like, I don't know, definitely not a brie, not a Jarlsberg, more like a mimolette. Yeah, more like a mimolette. Anybody like mimolette? All right, maybe like Gruyere, right? Like a Gruyere cheese? Yeah. Definitely not a semi-soft or soft cheese. Not like abortion. not a Jack, not a Jarlsberg, not a cheddar, at least not a soft cheddar. I mean, the Mimolette is a cheddar, but it's a hard cheddar. Who likes cheddar cheese? You got to go to Whole Foods and get some Mimolette. It is my favorite of all cheeses.
You need to get a Whole Foods here first. We'll be here in a couple months.
Yeah. All right, any questions?
Yes, we have a question coming from Faisal once more on Facebook.
Faisal.
Yes, we do.
I thought we said Faisal can't ask any more questions.
Well, there's a long one that he has that I'm sure he is curious on.
I'm just kidding. Faisal.
Asking, can you please do a video on how you diagnose a patient, including their physical examination alongside their MRI, which we agree most doctors and surgeons fail the patent on. I think it would be great. I think it would be helpful to see you hands-on with a patient, seeing how you touch the spine and help diagnose their problem.
Thank you, Faisal. We'll see. I'll consider that. Our Duke spine exam is proprietary, meaning that only we have access to that technology. So I'm not about to share it with the world. But we do offer free MRI reviews if you want to know what's wrong. And I don't want people getting in the habit of starting their own diagnostic center. We don't want patients becoming misdiagnosed by people that are sort of half trained by me, so to speak, if you understand what I mean. That would be most unfortunate if somebody, say, were to have some undeserved confidence in diagnosing spine conditions because they had a weekend course from Dr. Duke Majan. And then they gave patients the wrong diagnosis, the wrong treatment, and people suffer it as a result of my negligence or theirs. I wouldn't want that, right, Hector? I know I make things look easy, folks, but the best thing you can do is do our free MRI review, find out what's wrong, and come get it fixed. Faisal tells me he's coming to see me to get fixed. I have to believe him, even though he's been saying it for a long time now, right, Faisal? But I understand there's many reasons why people can't make it here. The most important is it's just, for some people, it's a long trip. And there's always economic reasons as well. I'm hoping someday that economics and travel will not be the barrier to coming to Duke Spine to get fixed. Just about done. Last few pieces. Look at that piece right there. That's a biggie. Well, big for this guy. I guess I didn't get it all. It broke apart. Broke apart again. I'm trying to get this last piece of herniation out, but it's a real stocking stuffer. Any other questions or comments?
At this moment, no current questions.
Man, that thing's big, huh? I'm only getting little pieces. It's like it wants to come, but it just won't. This is my last piece of herniation here, and it is taking its sweet time coming out. There we go. I think that's the bulk of it. Just one more look down the rabbit hole, and we're pretty much done here. I don't see any more pieces. That looks pretty clean to me. I want to just take one more peek and verify that we're done. Yep, there it is. That's the outside of the disc. You can see the epidural fat. We're done here. Next, I'm going to move on to his facet joints. So we will see you guys back shortly. Any last second questions?
No current questions.
All right, thanks for joining. We'll be back shortly for the facet treatment with our Duke plasma.